This is Yvonne Opheel, and this is my video for the external anatomy for the sheep heart. So first of all, starting out the pericardium, the visceral pericardium, it's this outermost layer, and this one is embedded with quite a bit of fat. Actually, I'm fortunate enough to have a tear, and you can kind of see that outermost layer that's glistening here. And so that's the outermost layer of the heart. Going through the rest, here's the apex or the base of the heart. I'm sorry, the apex or the inferior portion of the heart. The base of the heart is this area at the top, up here. The right atria is here. And the right atrium is where the deoxygenated blood returns to the heart. The left atrium over here has oxygenated blood, and that's going out to the aortic arch to then either go to the head, the upper limbs, or the lower body. So the auricles, the right auricle is here, the left auricle is here. The right and left ventricles, here's the right ventricle, and then the left ventricle. The intraventricular sulcus is this line. Inside of that, that holds the anterior ventricular artery. The pulmonary trunk, you see here at the very front. See if I can get the probe together for it. Hard to do this with one hand. Okay, so this is our pulmonary trunk. The aorta, is here, this big artery, and then I actually have two smaller openings where the arteries normally would have been attached. So from here on, I guess I could turn it over so that it's facing the right direction. So from here, we would see first on the far right-hand side of the heart, or the left-hand side of our picture, the brachiocephalic artery. Next to it would be the common carotid, and this large one would be the left subclavian. Okay. The superior and inferior vena cava on this are easiest to see from the back. Again, kind of hard to do this with just the one hand, but here is the superior vena cava. The inferior vena cava actually is just below that, right here. The coronary sinus runs along here. It's at the base of this bunch of large arteries and veins. Let's see, the coronary sites. Oh, the blood from all of these is going back to the right atrium, and they are all veins going back to the right atrium. The last thing is the blood that's getting carried in the superior and inferior vena cava and the coronary sinus are all deoxygenated. So again, going back to the right atrium, coming from the body, the head, and then the heart itself, all used up the oxygen and starting the cycle again. I think that completes the external anatomy, and I'll get to the internal in just a few minutes.